see how much you really know. We invite you to take our cardiologist's heart health quiz.
You know what's good and what's bad for your heart?
Too much salt is bad, I know.
Vitamins? I don't know. Do you mean like supplements?
Well, many people think they're in the know.
I might know some stuff.
When put to the test...
Is there a screening test?
Well, let's just say we heard a whole lot of waffling.
Are you going to grade me on this?
To set the record straight, here's cardiologist Dr. Jeffrey Gudis, who warns many old beliefs about the heart have turned out to be myths.
Specifically, one of the first questions we'll address is salt bad for your health?
I think it's bad.
I would say it's not good for you.
I think it depends on the individual.
The perception is that salt is bad for everybody, and it's simply not true. There's really no clinical evidence that a low-salt diet lowers your risk of a heart attack or stroke. In fact, 2 clinical trials looking at low-salt diets actually demonstrated an increased risk of heart attack and stroke.
Now, some people do need to watch their salt. People with heart failure, kidney failure, or high blood pressure. But for most people, Dr. Gudis says salt is nothing to worry about.
I would think you'd need sodium to help regulate something.
So salt makes your body hold on to water and helps to regulate temperature in the body. If you're young and healthy without heart or kidney disease, there's no reason to restrict salt in your diet. I think one of the next important myths in medicine is in the realm of vitamin supplementation. Do vitamins lower heart attack, stroke, and cancer risk?
Yes, vitamins are good for your heart.
Sure, yeah.
Clearly, there's a perception that vitamins help prevent disease. But when it comes to heart health,
the answer is that vitamins really serve no useful purpose.
The reason? Studies show in patients with high cholesterol, some vitamins such as C or E can actually interfere with the effectiveness of cholesterol-lowering medicine.
So why would you take a vitamin if there's no evidence that it can help you and there's emerging evidence that it could harm you?
Vitamin supplements may help prevent other conditions like bone loss and vision loss, but for your heart...
I think cardiologists are starting to take patients off their antioxidant vitamins. If you're going to supplement something, then my preference would be to supplement fish oil, which has been demonstrated to lower the risk of sudden death, lower the risk of heart attack and stroke. That brings us to one of the next myths in medicine, which involves the question, is fat bad?
No.
Yes?
Cause up your arteries, right?
Here's a hint. It's a trick question.
I don't think all fat.
The answer is no, not all fat is bad. Certain fats are very good for your health. The good fat is the omega-3 fat, the monounsaturated fat, canola oil, olive oil, nut oils. And the bad fats are primarily hydrogenated fat, synthetic fat. That's the fat that makes the chocolate chip cookie still soft and gooey after 6 months on the shelf. What I tell my patients to do is eat like a caveman. If a caveman can eat it, you can eat it. Fruits and vegetables, nuts and whole grains, dairy, a wide variety of meat, fish, and poultry.
Have you done well so far? If not, here's one last question to redeem yourself.
What are the screening tests for heart attack and stroke?
EKG, is that what it is? Isn't there something where they can inject dye and look at your heart and see if there's any blockage?
Those are good tests, but they're diagnostic. They're used to pin down problems in people who already have symptoms. We're talking about screening tests to find out who in the general population may be at risk.
Gee, I don't know about heart attacks.
There's a mammogram for breast cancer. There's colonoscopy for colon cancer. Well, heart attack and stroke is 7 out of 10 deaths.
You can have your carotid artery ultrasound.
The American Heart Association recommends 2 screening tests to evaluate heart attack and stroke risk. One is the carotid ultrasound, measuring buildup of looking for disease in the carotid arteries. The other test is a test called an ankle brachial index, where you measure blood pressures up and down the legs to try to define if there's blockages in the leg arteries.
In many people, plaque first shows up in the neck and leg arteries.
Screening tests can define risk that's 5 or 10 or 20 years away. And if we address the risk today instead of 20 years from now, we can eliminate the risk. If you have family history and you're not on any medicines to lower cardiovascular risk, then you should consider a screening test.
And with that, Dr. Gudis leaves us with one last bit of advice.
Diet and exercise, both and individually, are twice as powerful as any drug out there. There is no substitute for diet and exercise.
Nearly 450,000 Americans die from heart problems each year. It's important to recognize the signs of heart disease so you can take immediate steps to prevent problems.